Hello friends, welcome back to Block On. In this video, I am going to demonstrate the ultrasound scanning of lateral thigh, which will help you to understand the sonoanatomy and to perform the sciatic nerve block in supine position at 5 different levels. Before starting, let me make it clear that this is a scanning video only, so I am not going to demonstrate any live blocks here. You can skip the video if you have already learned the scanning technique. So without wasting time, let's begin. The patient is placed in supine position with the lower limb extended at hip and knee joints, as you can see here. So no external help is required for this positioning. The operator will be standing on the side to be blocked and the ultrasound machine will be on the opposite side. A pillow can be placed beneath the leg to make some room for placing the probe here on the lateral side and during needling. But this is not absolutely necessary. Just make sure that the limb is in neutral position or slightly internally rotated. Before placing the ultrasound transducer, we need to identify and mark some important landmarks. As you can see here, I have identified and marked anterior superior iliac spine, greater trochanter, and the superior border of the patella. To start with, we have the lateral approach of sacral plexus block in supine position. The probe is placed across the lower flank at the level of ASIS, posterior to the mid-axillary line or the line passing through the greater trochanter. We will continue our scanning up to this dotted line or the popliteal fossa level, keeping the probe posterior to this line. So next we have at the level of GT, that is actually lateral version of the GTIT approach. Then another approach of proximal sciatic nerve block from lateral side, that is at 2 to 3 centimeter distal to the greater trochanter. Then we have mid thigh or the mid shaft level sciatic nerve block from lateral side. And the last one was recently described as CAPS block. The scanning starts at the level of ASIS and then the probe is moved 1 centimeter caudally until the posterior part of the hyperechoic line, that is the ilium, disappears into the greater sciatic foramen. The sacral plexus lies posteriorly to the lateral border of the greater sciatic foramen and inferior to the piriformis muscle. The nerve block needle is inserted either out of plane from lateral to medial or in plane from anterolateral to posteromedial direction. Now the transducer is moved further distally and it is placed just beneath the most prominent part of the greater trochanter. Once the GT and IT are identified, the position of the transducer is adjusted to keep the IT in the center of the ultrasound image. As you can see here, the probe is pushed posteriorly. The hyperechoic sciatic nerve can be identified here lateral to the origin of the long head of biceps femoris muscle and beneath the gluteus maximus. Next, move the transducer further distally and position in the transverse plane 2 to 3 centimeter caudal to the most prominent part of the greater trochanter and as posterior as possible. Here, the sciatic nerve is identified as the hyperechoic oval or crescent-shaped structure posteromedial to the femur. In the mid-thigh or the mid-shaft approach, the probe is positioned in the muscular groove formed by the vastus lateralis muscle and the biceps femoris muscle. At this level, the skin to nerve distance is around 4 to 6 centimeter, even in patient with higher BMI. Here, the nerve is surrounded by vastus lateralis, biceps femoris long head, and the semimembranosus and semitendinosus muscles, as you can see here. The fifth or the last one is the CAPS block. The transducer is placed over the lateral aspect of the distal thigh, 5 to 10 centimeter above the popliteal fossa crease, targeting the sciatic nerve at or above the level of divergence. Here, The hyperechoic sciatic nerve is surrounded by the hypoechoic muscles and lies posterior to the hyperechoic shaft of femur and the popliteal vessels. I have already uploaded a detailed video on the CAPS block where I have discussed about advantages of supine lateral approaches. You can click on the I button and watch that video. For a quick recap, the scanning starts at the level of ASIS, and on moving distally, we'll get the sacral plexus view. On further caudal scanning at the level of GT, we'll get this lateral approach of GTIT view. Then 2 to 3 centimeter distal to the GT, we'll get this view. All these three consist of the proximal sciatic nerve block. Then at the level of mid thigh or mid shaft of femur, the sciatic nerve is bit superficial compared to the previous approaches. And the last one is the popliteal fossa block at the level of distal thigh, which is the CAPS block. That's all for today. Hope you have enjoyed this video. Catch you in the next one. Until then, keep blocking, keep rocking.